So here you are watching drug-induced sleep endoscopy with BIS monitoring in a 34-year-old male with history of choking, little bit of snoring, but mainly choking. He has got a grossly deviated septum on the left, as you can see here, almost completely blocking the left side. His body mass index is 28. He is more muscular than obese. So BMI is just a little high. His AHI is 14, most of which are half of them are obstructive apneas and half are hypopneas. So in the throat there is hardly any adenoid. The salpingopharyngeal folds are grade 0 by a Gloss classification. And at a BIS of 77, you can see the soft palate collapsing. He also has a little bit of tongue and epiglottic collapse. So for AHI of 14, hypopnea is half. He still has a multi-level collapse. Both his soft palate and the base tongue are obstructing, and the base tongue is actually also obstructing the epiglottis. So the BIS is 81. You can see when the epiglottis is also obstructing, you can't say it's a primary epiglottic collapse because the base tongue is pretty large and is pushing on the epiglottis. And in his effort to breathe, the base tongue is getting pulled, but the epiglottis is collapsing. Now, if I keep the mouth closed, still the whole thing is collapsing. And it's pretty constant. And that is also in spite of keeping his mouth closed. A BIS of 69, which is adequately sedated, he is still having a collapse at the level of the soft palate and the base tongue, epiglottic collapse as well. So we can see some lymphoid tissue at the base tongue and little bit of muscular tissue. So he's a good candidate for a two-stage surgery. The first stage we can do the nose, septoplasty, tubnoplasty, and second stage we can perform the uvulopalatopharyngoplasty, suspension bridge variety along with base tongue reduction and glossopeglotopexy. So that's what is the message here, that for a AHI of only 14, young person, BMI being only 28 and muscular, still he has got a multi-level collapse. So he requires a two-stage surgery. First stage, septoplasty, tubnoplasty. Second stage, uvulopalatopharyngoplasty with suspension bridge along with tongue base reduction and glossopeglotopexy. Right. So the base is in 70s, and constantly the tongue base is obstructing and the epiglottis is obstructing. So if I put him on one side, this was on his back. Now if I try to put him on his left side and figure out what happens when the head is rotated on the left. Now let's see what happens. So for now he is awakened. So I'll wait for him to go into sleep again. And still, even on the left lateral position, you can see the tongue base obstructing, even on the left lateral position. In the left lateral, if I keep his mouth completely closed, you can see the soft palate is obstructing, and below that even in the lateral position, the tongue is still obstructed. Fine. So he requires a two-stage procedure as we said earlier. Thank you for watching.